adenovirus remains in the people having a healthy immune system. But an HIV patient, it reaches eyes, digestive tract, and then you have the viral hepatitis. HIV develop liver toxicity due to the medication, and they are more likely to develop the chronic infections and complications with cirrhosis of liver. And then we have the herpes simplex virus, which causes genital herpes. And then we have the skin infection due to the human genital warts. And we are going to retest which is papillomavirus and papillopathy. Extremely serious brain infection which is caused by the human papillomavirus JCV. So then we have the fungal infections, in which the most common are the candidiasis. In candidiasis we have the thick white coating
of the tongue.
Here symptoms in which the mouth and the esophagus, there is plaque formation, and there is cryptococcal meningitis, which is more severe, and in which the membranes and the fluid surrounding the brain and the spinal cord are inflamed. And then we have parasitic infections, in which pneumocystis carniae pneumonia is the most important one. And then we have the toxoplasma, cryptosporidiosis, commonly found, which is the agent is commonly found in the animals, infected from the food or from contact with that animal. And then we have the cancers. In the cancers, Kaposi sarcoma, non-Hodgkin's lymphomas are the most important ones. And the other complications include the wasting syndrome. In wasting syndrome is basically the loss of at least 10% of the body weight, and often accompanied by the diarrhea, chronic weakness, and fever. And then we have the neurological complications. In neurological complications, we have confusion, forgetfulness, and we have changes in the behavior, we have depression and anxiety, then we have the dementia. Most important is the dementia complex. In the dementia complex, there are behavioral changes, and there are poor circulation, there is stroke, there may be headache, and then we have the pelvic inflammatory disease. I get information on the internet that at least 10% body weight.
Because in any disease that we have read, it refers to the lean body mass. That's more important.
But the wasting syndrome is accompanied by the diarrhea, the chronic weakness, and the fever. Not simple the 10% loss of body weight. It's a syndrome which includes the fever, diarrhea.
I was asking about one component of the syndrome, that is the weight or the lean body mass. Okay, and then one more thing was you told us about that there are increased chances of liver toxicity due to the drugs, and why is that?
Person is immunocompromised, and the drugs that are used are toxic to the liver, and the patient is already immunocompromised. Patient is already immunocompromised, and the drugs which are used damage the liver.
The drugs are toxic. They are
hepatotoxic.
Toxic to the liver.
No, I didn't want to ask about the antiretroviral drugs or the drugs related to HIV. I thought maybe he said about the gel that I use. They become more, the liver becomes more prone to toxicity, drug toxicity. That's why. Okay, fine. Okay. Now CD44, Kashif.
It actually occurs along with the TB. So they are considered along with the HIV. So they are considered as a twin epidemic because mostly they occur simultaneously. When the HIV occurs and the TB occurs. So the tuberculosis may be the first manifestation of the HIV.
Yeah, there has been resurgence of tuberculosis across the place. So every patient has to go to the
Excuse me.
Yes, Bilal.
Is that we have one very powerful scenario. Now, according to this scenario, what I feel is that taking something from drugs and loss of weight and with planning and its planning relations, okay? Now he has had a road traffic accident 2 years ago. Now the most common opportunistic infection in the people suffering from AIDS is due to pneumocystis Okay? Yeah, that is the most common infection. So what I feel the patient is in 70% of the cases, this is the most common opportunistic infection. And these are the main signs.
Yeah, okay.
So what I feel is that the patient is
Okay, after your study of sinus influence. Okay, fine. Okay, in the meanwhile, let's do away with the lab diagnosis. Yes.
Lab diagnostics can be two types. You can have a specific lab diagnosis and you can have non-specific lab diagnosis. So we can use the physiological findings and we can use the isolation of virus. For the physiological findings, we can use the HIV testing kit, which is basically based for testing the antibodies which is present in the serum of the patient. For that, we use two types of tests. One is the presumptive test and the other one is the confirmatory test. For the presumptive test, we can do ELISA, and which can give us results. Which can give us a positive result, but in some cases it can be false positive. And to confirm the diagnosis, then we go to the Western blot, which gives us a more specific and more confirmatory test. And on the other hand, we can also do the virus isolation test, but it is very expensive and it needs like a lot of training and everything. And then we can do the PCR. The PCR is done in patients in which, like you mentioned, quickly about the things in graph. Like, in which the virus count is less, you can detect the viral DNA and in the microphage and stuff like that. And for the non-specific sizing, we can do the CD count and CPC and all the other tests.
Okay, these are the physiological tests.
CPC and other tests in non-specific lab findings. You can do them or you can skip them. No, you can do them. They will not tell you about the prognosis of the disease. They will tell you about the treatment. They will tell you about like the prophylaxis and stuff. But basically, the specific ones are the Western blot and ELISA, the PCR. Alright, so ELISA and Western blot tell you whether there is disease or no disease, right? ELISA is like a screening test. Western blot is confirmatory. But as for the rest of the tests, CBC, and then there is the immunology, CD4 levels, sugar levels, other things, and there's screening for other organisms in the blood, various viruses, virus loads like virus, etc., etc. All that will tell you at what point the patient is standing and how are you going to deal with that patient from that point on.
Management.
So you need to do all of that, but now if you start with history and examination, then you see on all of these investigations, and then you decide what kind of treatment you have to offer.
Okay. Now we shall do the treatment. Omar?
During last practicing period, where effective treatment therapy is introduced, it's known as HARD, HAARD, and it stands for highly active antiretroviral therapy. Basically, it has resulted in a decrease in the viral RNA and reversal of the decline in CD4 cells and a decrease opportunistic infections. Basically, two reverse transcriptase inhibitors along with protease inhibitor is included in this therapy. Reverse transcriptase inhibitors are divided into nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. Nucleoside reverse transcriptase inhibitors include acidity, gabapentin, vidanisone, lamivudine, and some other many others. As far as protein inhibitors are concerned, there are some and partners. Two reverse transcriptase inhibitors are protease inhibitors. Triple therapy. And there is also another class of drugs known as the fusion inhibitors. And fusion drug. Actually, this drug binds to GB41 and inhibits the fusion of the CD4 cells with the HIV. So this is the therapy.
Okay. Okay.